I'm Dr. Maxim Chumak. Let me introduce you to Dr. Shapiro. Actually, his introduction is mostly unnecessary because his name is kind of similar like a Sigmund Freud in the field of psychology, so he's in the field of hair restoration. I was attending his lectures, when I started my practice, and he's been around for a long time, and he carries wealth of knowledge, and was visiting our clinic today, tried some treatments too.
Thank you very much. Yes. Actually, the reason I'm coming is I have been doing this for a long time, but you have to change with times. And this field's changed tremendously since I started. When I started, it was the big graph, mini graphs, the FUT and the FUE, but if you stand still, you don't keep moving forward. I think Einstein said something like that. There's a few people that I've watched at the meetings lately, like you, that have had some very interesting things, and I decided I wanted to visit their clinics and see some of the new stuff, and that's one of the reasons why I decided to visit you, because I have an exoskeleton. At the other thing, I've never seen anything like that. It's in the hyperbaric chamber. Nobody else is doing that, and figured I'd pick up some things, and I haven't been disappointed. It's been a very good trip. Actually got the hyperbaric on me. Maybe it'll make me smarter. And so it's been a good trip. In fact, I'm going to want to talk to you more because it's so much. You have so many little things that other people don't do. It's like the PRP, the Folix, the hyperbaric. Your actual program, on people when they're local, where they can come in a lot, or when they're not local, because I'm sure there's a timing, what time you do it before, during, after, and whether you're using it also on people without surgery. You have a program instead of just finasteride and minoxidil. I'm sure you're doing quite a bit. Right?
Yes.
So I'm curious what that is.
Yeah, so basically, I think surgery, and I'm sure, we, as a surgeon, we like to provide the best possible case scenario to enhance the results and ensure best survival rate for grafts. And I've been thinking about different strategies. One reason why I picked hyperbaric chamber, I've been a technical diver for many years, and I learned the physiology of partial gas pressures, what it does with the body. And to me, it was sort of such a natural addition to hair restoration surgery, because it theoretically and practically could address every single concern that we have and what we're terrified. We're terrified about the recipient area, abdominal area necrosis, right? We're terrified about excessive swelling that can prevent oxygen delivery to grafts, and poor survival rate due to poor oxygenation and so on. So when you add this chamber and you bring in 100% oxygen, you don't need any vascular system. The gas just dissolves entirely in your system, and it has no problems penetrating every single cell in your body.
Follicular unit transplantation, back when they first came in from the baby grafts, these are tiny, very fragile grafts, and poor survival. People didn't even think they'd grow in the beginning. And over the years, the biggest steps have been one of the biggest additions have been things to make survival better, both in the surgical part and around the surgery, and the different solutions, the different way you handle the grafts, the timing. There's so many things that make these grafts not survive. And if they don't survive, you don't get the density, because one of our main goals is density. So survival equals good results.
I've been actually treating a few patients after plastic surgery procedures, rhinoplasty, facelifts, and it does cut down the recovery time, just like it happens with hair transplantation. And referring to your graft survival, I remember your lecture about the graft survival. One thing that I learned, we have to be as gentle as possible. Such a sensitive structure, like any excessive manipulation, mechanical injury can greatly affect the survival rate. During your surgery, you want to train your staff during counting of grafts, right, to be as gentle as possible. That's one of the reasons I installed these cameras, so that I can observe. The goal is to provide the best possible results for our patients.
And I think basically this whole new area of regenerative medicine, whether it's the growth factors, the exosomes, the PRP, the Folix, which is doing it naturally, that's the wave of the future, actually.
Yes.
I think so.
And yes, and one of the things that we are looking at is just not. We used to think, okay, this is your hair transplant. We just did it now, but let's think about what's going to happen in the future, right? How we prevent future hair loss, and around the surgery. Yes, some people do PRP, like you mentioned, you do exosomes a lot, right?
Well, yeah. I mean, the thing is, our goal. We have two goals in hair transplantation. One is to make it look natural, and that's more of an art thing, which hairline and all that. But the second one is to give them meet their expectations towards density and coverage, and that's going to have to do with not just now, because you can make someone look good now, but it's the future, because of the future hair loss. I mean, so you have to be planning ahead, and that's why a lot of these things we have to do is to prevent the hair loss. And there's a lot more to that. There's also knowing the genetics, knowing the pattern, knowing what pattern they might be, measuring their donor. Actually, I think of hair transplants as one of the more complicated. Even a lot of plastic surgeons, they come to watch us do it, and they think they want to get into it, and they leave saying, "Nah, I'd rather do a 5 blephs in a day. This is too complicated, too hard."
Yes.
Because there's a lot to it.
Yes, absolutely. It's a multi-stage procedure, unlike any other surgery. You just start with facelift and you finish. But here you have to have this harvesting, implantation, hairline design, and then all these factors that you have to address.
And you've been doing this for how many years now? Like a long time?
Total is 15 years.
Yes. And the important thing about the experience is in most cosmetic procedures, a person does a procedure and a couple weeks later, a month later, they know the results, and they can do 10 of them. So they get their feedback and they get to change this. When you do a hair transplant, you don't see the results for a year, and it takes 2 of them. So you don't even know if you're any good for 2 years,
right,
for each one. So while you're learning, and during that time, they're changing all these new things. So you're changing your procedure. It's very difficult, and the only way to really be good, I think, is to have the experience and have
100%, yes. So, and this is something that
it just makes it.
Everyone in the hair restoration field, doctors, they all know Dr. Shapiro.
Thank you. Anyway, it's been a pleasure visiting your clinic.
Thank you so much.